so just to start again, so tonight's talk is going to be about hereditary breast cancer, more specifically on how to determine when your breast cancer is hereditary and when it is not. So to start off with, I'm just going to go through the different causes for breast cancer. So if you look at this graph, so this represents all the breast cancers that you get. And you'll see that the majority, about 70 to 80% of breast cancers, is something that happens out of the blue, and it's mainly because of lifestyle factors or environmental exposures. So just to list a few things in this graph. And then you get this little group that's called familial, which is about 15 to 20%. And that is when you see that there is a very strong family history. So you have a lot of family members that are affected by breast cancer, and you've had a genetic test, but we cannot identify the gene. Just because there isn't a gene doesn't mean that it's not familial. It just means we cannot identify the cause. And then you get this tiny group, this 5 to 10%, that is hereditary, where you've got a strong family history, and after you've had genetic testing, they could identify the cancer-causing gene variant. So I've just listed a few. So the most common ones that you've probably heard of is the BRCA1 and the BRCA2 genes. But there's also a few others that are less common, and as the technology is advancing, we're identifying a few more. At the moment, we probably have about 20 different breast cancer genes. So when you go and see a genetic counselor, they will usually ask you about your family history, and they'll draw this family tree. So just to explain, the circles are the women in the family and the squares are the men. So if you look at this family tree, for instance, there's certain clues that makes me wonder whether this isn't maybe a hereditary breast cancer. So the first clue is the young age of onset in this person, where she was 31 years old when she developed cancer. The other clue is the type of breast cancer. So usually if it is a triple negative breast cancer, we are a little bit more worried that it might be genetic, and also if it's a rare form of breast cancer. The next clue is that she also has a family member who has had breast cancer in both of her breasts. So women who have bilateral breast cancer, they have a higher chance of it being hereditary. Then if you look further in the family history, you'll see that there's also a woman who's had both ovarian cancer and breast cancer, and that is also a reason to be concerned. And then if you look at the family tree as a whole, you'll see that there's quite a few family members that have been affected with cancer. And I call it associated cancer. So it would be things, so we know that the breast cancer genes, they often link ovarian cancer and breast cancer together. And they also link prostate cancer in men, for instance, and pancreatic cancer. And then the last one is also, we look at the ancestry of the person. So if the person is of Ashkenazi Jewish ancestry or Afrikaner ancestry, then we're also a little bit more worried, because we know that BRCA1 and BRCA2 variants are quite common in those population groups. So now the next question is, so if you now see all of these clues, so how can you then know for certain whether that breast cancer is now hereditary or not? So the answer is you can go for genetic testing and counseling to assist you with that process. So usually the genetic counselor will give you a few options of genetic testing, and the first option that's given to women of a certain ancestry, so for instance in our South African population, you will ask the Xhosa ladies, the Afrikaner ladies, and Ashkenazi Jewish. So the first option is just to go and look at the BRCA1 and BRCA2 founder mutations. So just to illustrate what that means, so that is why I have a picture there with a bunch of pages from a book. So if you see a gene as an instruction manual, so an instruction book that you read from the first page to the last page when you do a genetic test, then this particular test is not going to read the full gene. So it's not going to look from page 1 to the last page. When it's only the founder mutations, this genetic test will only look at specific pages of that book. So it's not a comprehensive test. It only tests for about 3 to 7 gene variants and on specific pages of that book. It is a quick test, so you'll get your result back in a week, and it is also the cheaper option of about 1,000 to 2,500 Rand, and it's done locally. And the medical aid usually covers the cost if you've already had breast cancer. But as I've mentioned, if you now have only the founder mutations, then, and this test comes back negative, meaning there's no variant, it does not exclude all possible gene variants in the BRCA1 or BRCA2 genes. So if you have a founder mutations test and it's normal, it does not mean that you do not carry those gene variants in those genes. So that's where option 2 comes in. That is the full screen of the BRCA1 and BRCA2 genes. So if you once again look at that analogy of an instruction manual, with this test, you now read the entire book. Okay, so you read them from the last page, from the first page to the last page. It takes longer to get the results back. It takes about 6 to 8 weeks. It's also done locally. It's a very expensive test. It's the most expensive one. It's about 10 to 12,000 Rand. Sometimes the medical aid will cover the cost with motivation, but I haven't been very successful with that in the past. So now the caution with this test is, like, if this test comes back normal, it means that you do not carry a BRCA1 and a BRCA2 gene change, but there is still a possibility that you carry a variant in a different breast cancer gene. And you'll recall those other genes that I've mentioned. So that is where test number 3 comes in, where it's a breast cancer gene panel. So you get to select the genes you want to look at. And in this analogy, basically you look at a few instruction manuals at the same time. So you read the books, all of them. So for instance, where the previous test you would only look for 2 genes, with this one you can either select the breast cancer genes, which is about 20, or you can extend it to all cancer genes. So the results is available within 3 to 4 weeks because this is an international test. So the turnaround times is quicker than the local testing. And it costs about 5,000 to 5,500 Rand, depending on the exchange rate, because in US dollars it's 250. So the medical aid usually does not cover the cost of these tests. And if we make use of international laboratories, we can sometimes offer free of charge testing to the family members. So that sort of makes up for the cost of the test. And the nice thing about having a breast cancer gene panel is that if this test comes back negative, then you can, and there's not a strong family history, then you can feel rather reassured that this is not a hereditary breast cancer, and this was something that occurred out of the blue, and mostly due to environmental or lifestyle factors. Okay. So I always say, you know, trying to decide on your own what type of genetic testing is appropriate for you is quite difficult to do because there's so many different options. So that is why genetic counseling is essential when wanting to go for a genetic test, because the genetic counselor will help you decide on the appropriate genetic test for you and your family. Because in some families, the gene panel might not be the best option, and they can rather go for the Afrikaner founders, for instance, which is a cheaper option. We also help you request the genetic test, and then we explain and interpret the results. And we use those results in combination with your family history and your lifestyle factors to do certain cancer risk assessments, which helps us to decide on the appropriate risk management plan for you and for the family members. And then if we do find a gene variant causing cancer, we can refer you to the appropriate specialist. And we can obviously also assist your family members with having testing done if they require testing. So I would like to illustrate what a genetic counselor does. So that's why I said that I'm also going to share a tale of three ladies. So these stories are inspired by true events, but I've obviously changed a lot of the names, and I've also modified the family histories a little bit just to protect the identities. So first lady that I have, her name is Rose, and she developed breast cancer at the age of 71. And we obviously discussed her family history, and you can see she's got quite a lot of family members. She's got one brother, one sister. She's even got quite a few grandchildren already. And you'll see there's no one else in the family who's had breast cancer at all. But there is a family member up here, so that is her paternal grandfather, so her father's father, who's had prostate cancer. So I would say in this case, I would speak to this lady, and I would be very reassured. I would be trying to be very reassuring to say, listen, breast cancer is very common. About 1 in 8 women will get breast cancer in their lifetime, and we see it more often after the age of 60. So I really do not think that genetic testing is necessary, because she doesn't even fit the right ancestry for testing. Okay, so I would say to her, don't think it's necessary to have testing done. So I would not recommend that, and I would still do risk assessments for her, but I can tell you now already, she's going to have a low risk of recurrence at her current age. So lady 2, I've got Lindelwa. So she also developed breast cancer, but at a younger age. So she developed right-sided breast cancer at the age of 42. And when I did the family history, I saw that there's quite a lot of family members who have had breast cancer. And you'll see that there's also a male there's 2 males in the family who has had breast cancer. And so the one was quite older and the other one was quite young. And you'll also see that there's another male who developed prostate cancer. So this is a very extensive and suggestive family history, because she's also, of course, an ancestry. So in this case, it really does look familial. It does look hereditary. So I would strongly recommend genetic testing. So now she says, okay, I hear what you're saying, and I am worried about this because I can see my family history is very suggestive of this. And I've got 2 children, and I really want to be able to prevent breast cancer in them if it's possible. So we do the genetic test. She decides on the gene panel. So the test comes back. We do all the possible genes that we can. So there's about 84 genes that we tested in her, and the result comes back negative. So to conclude with this, so now I use the genetic test result, and I use certain lifestyle factors and the family history to calculate her risk of getting another breast cancer. So I use models to do that. So in this particular instance, I use the CANRISK model. So if you look at this risk, you'll see that her risk of getting another breast cancer, so if you see the solid line, blue line is her risk, and this dotted line is the population risk. So you can see it's much higher for her than for another woman of her age. So, and if you look at it, it's about 46.8%. So now I say to her, listen, if I look at your risks and I look at your family history, there's a definite familial contribution to the cancers in the family. And there's a high risk of having another breast cancer. So I would actually recommend a bilateral mastectomy for you. And I would strongly advise that we do these risk calculations for your family members as well, to see if their risks is also high, because then they can also qualify for risk-reducing mastectomies. I think this is especially important for families like that, and I have to say within our African families, because we do not know all the breast cancer genes yet. There's still more genes that we are going to identify in the future. And the African population groups, they are an understudied group. So I would much rather keep this lady safe now with the knowledge that we currently have, because I do think that there will be other genes in the future, and I do think that there is a gene in this family. We just don't know what it is yet. So then lady 3 is Yakumin. So she also developed breast cancer. She was a little bit older, so she was at the age of 52. It was right-sided breast cancer. She also has a sister who developed breast cancer at a little bit of a younger age, so at the age of 47. And you'll see that her dad passed away from pancreatic cancer, and his sister also had breast cancer. And then that sister had a son with skin cancer, so that's the melanoma. And then you'll also see that her paternal grandfather had prostate cancer. And then if you look on her mother's side, you'll see that her uncle also had prostate cancer at the age of 70. So for this family history, I was quite concerned because I can see that there's quite a few cancers in the family, and I know that there is a particular gene that combines skin cancer with prostate cancer with pancreatic cancer. And I was also worried about her ancestry because both sides of the family is of Afrikaner ancestry. So I recommended genetic testing, and she agreed, and we did the test, and we were able to identify the gene variant causing the cancer in the family. So we could say to her, your cancer was because of a BRCA2 gene variant, and it was the common Afrikaner one that we found. And you'll see with this result is that this was not only important for her cancer risks, but there's also a chance that it can cause ovarian cancer. And also for the younger generations, there's a risk of a condition called Fanconi anemia. But I'll talk a little bit more about that a bit later. So in her case, I also did a CAN risk model risk assessment. And you can see once again, so the solid line is Yakumin, and you can see her risk is much, much, much higher than the general population. And if you look at the risk figures, it's 69.1%. So that is a very high chance of developing breast cancer again. So for her, I also recommended double mastectomies with reconstruction. And then because I know this is an ovarian cancer gene as well, I did a risk assessment for ovarian cancer. And you can see the ovarian cancer risk is not as high as the breast cancer risk, but it is still significantly higher than the population risk. So the population risk is 2%, and her risk was 6.4%. So in this instance, I say to her, well, you've got a high risk of ovarian cancer as well. You have already completed your family. You're already experiencing menopausal symptoms. So I would recommend that we rather remove both of the ovaries to eliminate that risk. Then, because she has a BRCA2 gene variant, there are other cancers associated with that as well. So I could say to her, listen, well, we've now spoken about the breast cancer risk, we've spoken about the ovarian cancer risk, but there's also a slight increased risk for pancreatic cancer of about 1 to 3%. Now, there's no additional screening that we would do for that or additional surgery, but we know that if you carry a gene and you smoke cigarettes, it significantly increases your risk. So I would advise that if Yakumin was a smoker, in this case she wasn't, but if she was, I would strongly recommend that she doesn't smoke at all, and that she tries to maintain a healthy lifestyle. Then the other risk that's quite important is the melanoma risk. So you can either have a melanoma on the skin or in the eye. It's slightly elevated, so it's not a very high risk, but I have found that in our South African climate, it is a little bit higher than in the international countries because of our sun exposure. So I would say to it is advised to go for yearly skin assessments just to make sure that there's nothing growing, and also to always wear sunscreen and sunglasses when you're exposed to the sun. And then obviously if Yakumin was a man, or if I tested her brothers, then I would also advise them on the prostate cancer risk. So we cannot forget about that. So I also say that, so this is something that I always add. So for certain genes, there is targeted chemotherapy available. So for the BRCA1 and BRCA2 genes, they've already got chemotherapy that they can use if the patient has a recurrence, okay? And it's mostly for ovarian cancer at the moment. So if you've had ovarian cancer once and we see that the conventional chemotherapy isn't working anymore, we can try and give you a PARP inhibitor to see if that isn't more effective. So I think in the future, your genetic status will become very, very important when deciding even on your chemotherapy. So now I've spoken to Yakamine about her risk. So what about her family? So now we can offer offer testing to the family members. So they all agreed. So we tested all of them, and these were all the ones that tested positive. So you can see that one of her daughters carries the BRCA2 gene. You can also see a sister carries it. And then on her paternal side, you'll see that a paternal cousin also carries it, and his two daughters. So we can now offer preventative surgery and additional screening for those individuals. And we can try and either prevent cancer, or we can try and pick it up at an early, more manageable stage. And then very importantly, so for the family members who are still young, so for the younger generations, who are still planning to have children, we can actually offer prenatal testing for the BRCA2 gene. So you can either decide to have an IVF pregnancy, when they obviously take the egg cell and the sperm cell and they create the embryo, and then you can test that embryo and only implant the ones that do not carry the BRCA2 gene. Or if you decide to fall pregnant, you can have the pregnancy tested. And then very important for the Fanconi anemia risk. So Fanconi anemia is a condition that only occurs when a person carries two BRCA2 variants. So our cancer patients usually only has one BRCA2 gene that's faulty, that has a variant in it. But if you've got Fanconi anemia, you have two faulty BRCA2 genes. So if the mom carries a BRCA2 gene and the dad carries a faulty BRCA2 gene, then there's about a 25% chance to have a baby with Fanconi anemia. And that is a very serious condition, and those children have a reduced lifespan. So it is important to know that. They also have an increased risk for cancers and other malformations. So it is important not just for the cancer risks, but also for the future generations. So just to summarize, so this is obviously just a quick message. So to summarize the most important points, so it is very important to seek advice regarding cancer risks if you are concerned that there is a familial or hereditary cause. So it's important for you, but it's also important for the rest of the family, because it can be potentially life-saving for you and for the family members, because if we can pick up the cancer at an early stage, we can manage it and we can treat it and you can recover from it. Or ideally, if we can prevent it with surgery, then that is a very good option to consider. And then also, if we identify this gene, then it is important for the future generations as well. So for your children and your children's children, it is important. And as I've mentioned, new treatments and therapies are becoming available. So I think that if you know your genetic status, you will be first in line when those treatments become available, if it is of relevance for you. Yeah, so I think that's pretty much what I had to say. And then you can just see the last slide is my contact details. So I am based at the Panorama Healthcare Centre at Paxo with Dr. Myberg. So you're welcome to contact me if you've got any more questions. We're obviously going to have a bit of a discussion now, and I'm also going to ask we've asked a few ladies to also share their personal stories about breast cancer and the whole having to go through the whole genetic testing route and all of that. So yeah, so I'm going to hand over